Hello, I am Rachel with the College of Nursing and Health Innovation at Arizona State University. Today we'll be demonstrating how to perform a central line blood draw. The concepts of safety and infection prevention during this skill are paramount. Remember, the central line is inserted directly into the central blood supply, so adherence to safety is vital to prevent infection and unnecessary blood loss. The concept of evidence is also important. We use up-to-date evidence to support the way in which we perform a central line blood draw so that we can reduce the risk of infection and adverse outcomes. Finally, the concept of patient education is key to helping patients understand why we are performing certain skills and the signs and symptoms to look out for and when to notify the provider. Pay attention to how Kayla maintains safety and infection prevention throughout the demonstration. Now let's watch Kayla as she performs the central line blood draw. We are going to start with the S-bar.
Hi, my name's Jessica. I'm from the ER. Is it okay if I give you a report? Yeah, go ahead. Okay, so I have Chesty Chester. He came to the ED via EMS complaining of shortness of breath and upper abdominal pain for 3 days. He's a full code status and he has no known drug allergies. His background includes a history of cystic fibrosis. He had a lung transplant 4 years ago and he was recently hospitalized for pneumonia. During that time, a central line was placed. For my assessments, his last blood pressure was 138/78, heart rate 88 beats per minute, respiratory 34, temperature 38.1, and he was satting 93% on 2 liters via nasal cannula. His pain is a 5 out of 10. For my system assessments, he's drowsy and oriented ×3. His left lung is clear to auscultation. His right upper lobe has inspiratory wheezing and fine crackles. His right lower lobe is diminished. His breasts are symmetrical, but he has labored breathing, and he has substernal and intercostal retractions. When he first came in, he was 84% on room air. He complains of pain on inspiration just below the sternum. He's regular sinus rhythm on the monitor. His skin is warm and dry and normal color. His central line is clean, dry, and intact, and no phlebitis or infiltration noted. The patient is voiding clear yellow urine in the urinal, and his bowel sounds are present ×4. The patient is weak and ambulates with 1 assist. My recommendations: the physician has ordered a set of labs to be drawn immediately from the patient's central line. You can find the order in the chart, as I'm not sure which labs need to be done. Do you have any questions? No, I think that's good. Thank you so much. Thank you.
To start, Kayla will verify orders from the doctor.
So I'm looking at Chesty Chester's electronic medical record, and I have his MRN as 5986711 and his date of birth as 5/15/1989. I do have orders from the physician for labs including a CBC, a BMP, and cardiac enzymes stat.
Now Kayla will gather up all of her supplies. This includes clean gloves, a mask, alcohol wipes, 2 10 ml normal saline flushes, a vacutainer with appropriate blood specimen tubes. For this patient's labs, the nurse will need a lavender tube for the CBC and a green tube for the BMP and cardiac enzymes. You will also need specimen labels with the correct patient information, a biohazard bag, and a biohazard container. Once you have all of your supplies, you are ready to go into your patient's room. First, introduce yourself to the client, provide for privacy, and perform hand hygiene.
Come in.
Hello, I'm Kayla. I'm going to be your nurse today.
Hello.
Remember to verify the patient with 2 identifiers and MRN number. Check for allergies and fall risk.
Before we get started here, can I have you state your first and last name and your date of birth, please?
Chesty Chester, May 15th, 1989.
All right, perfect. Thank you. And do you have any allergies?
No.
All right, awesome. And I do see that the patient has a fall wristband.
Explain the purpose and procedure to the patient, answering any questions they may have.
I will be performing a central line blood draw today. It involves taking blood from that line in your chest. Do you have any questions for me?
Okay, no, thank you.
Raise the bed to a comfortable working height. Don a clean mask, perform hand hygiene, and put on clean gloves. And then begin to assess the central line insertion site. Always assess the insertion site prior to accessing, observing for any redness, warmth, tenderness, swelling, or drainage. Inspect the catheters for kinks or tears and the hubs for cracks. Ask the patient if there is any pain at the insertion site.
Do you have any pain right around this insertion site, Mr. Chester?
No.
Good.
When there is more than 1 lumen, choose the most distal lumen for blood samples. Clean the hub with the alcohol wipe for 30 seconds, allowing it to air dry completely. Attach a 10 milliliter flush. Unclamp the catheter and aspirate for blood return. After blood returns, flush the line with 10 milliliters or whatever is indicated by your patient and hospital policy. Now you are going to withdraw 10 milliliters of blood to waste. After drawing your waste, you will reclamp the catheter, remove the syringe, and dispose in the biohazard container. Now, clean the hub again. You will do this for 30 seconds. Once you are finished cleaning the hub, you will then attach a vacutainer to the hub and unclamp the catheter. Attach the appropriate specimen container to the vacutainer and allow the blood to fill to the pre-specified amount. Do not force the specimen tube, it will fill automatically. The correct order of the tubes for this blood draw is green and then lavender. Gently invert the tube 8 times to mix the blood with the additive in the tube. Do not shake the tube. Repeat this steps as many times as needed to obtain all specimens and reclamp the line when finished. Remove the vacutainer, clean the hub, and let air dry. Attach a 10 milliliter flush, unclamp the line, and flush the line with another 10 ml or per policy. After flushing, clamp the line again, remove the syringe, and dispose of it in the biohazard container. Clean the hub again with alcohol and place a disinfecting Kuros cap on the hub if indicated by policy, or reattach any IV tubing and restart infusions. Remove gloves, clean hands, and don clean gloves. Label the blood specimen with the patient's information, remembering to add your initials and the date and time the sample was obtained. Place in a biohazard bag and send to the lab immediately. Now you can remove your gloves and perform hand hygiene. You will perform documentation, including your assessment of the insertion site before beginning, any difficulties during the procedure, the time and date the labs were drawn and sent to the lab, and the patient's response to the procedure. Make sure to clean the environment, perform hand hygiene, and lower the bed.
And all done, Mr. Chester. Are you feeling okay?
Yes, I feel fine.
Good. I'm going to take these to the lab. Do you have any questions for me?
No, thank you.
Provide your patient with post-procedure education.
I do want you to keep an eye on your insertion site. If you start to feel any pain, swellness, you see any redness, I do want you to give me a call. Use your call light, please. All of those are signs of infection.
Will do. Thank you very much.
That concludes the demonstration for a central line blood draw. Thank you so much for watching.